This is a PowerPoint presentation on pediatric health promotion in case study format. If you guys have any questions as we go through this, feel free to email me, ask me questions through Canvas. Hopefully, working through some of these case studies will help solidify what you are reading and watching and learning in your module for this week. We will be discussing 2 case studies. This will be the first case study that will be discussed. Nelson is a 12-month-old infant that presents to the office for a well baby visit. He is accompanied by his mother, Kylie. Kylie states that Nelson has been healthy since his last well baby visit at 9 months of age. He has had no visits to the urgent care clinic or the emergency room in the interim. Kylie is concerned that Nelson's appetite has diminished. She states that he is not eating as much lately as he had been. His diet. Nelson has transitioned to a diet with whole milk. He drinks 5 8-ounce bottles of whole milk each day. Nelson is described as a picky eater. He rarely eats foods that are offered to him and instead prefers to drink from the bottle. He is not currently taking any multivitamins. Kylie states that Nelson has 4 to 6 wet diapers daily. He does not have any diarrhea, but does have occasional constipation that is relieved with prune juice. Nelson sleeps about 13 hours nightly, but does not take any naps during the day. He does not have any problems falling asleep or staying asleep. His nighttime bedtime routine includes bath and bedtime story read to him by Kylie. Nelson is able to walk while holding onto furniture. He can also stand unassisted for about 5 seconds. Nelson says dada and mama and has words for bottle and milk. Nelson was born at 37 weeks gestation, if I can talk right. He was delivered vaginally with assistance of vacuum. During the pregnancy, Kylie had no falls or infections. She did not drink alcohol or use illicit drugs. Nelson's birth weight was 3,000 grams, and his APGAR score was 8 at 1 minute and 9 at 5 minutes. His past medical history includes otitis media with 3 episodes. Otherwise, no injuries or illnesses were noted. Nelson was born to a 20-year-old mother. He has a 2-month-old younger sibling. He lives at home with his mother and paternal grandmother. Nelson's father is currently incarcerated. Nelson's mother does not currently work outside the home. The family does receive rent subsidy from Section 8 and food subsidy from WIC program and food stamps. No pets or tobacco use is in the home. Nelson's mother has no health problems noted. His father is 32 years old and has no history of chronic disease. His maternal grandmother has a history of breast cancer. His maternal grandfather has high blood pressure. His paternal grandmother, 48 years old, is healthy with no health problems. The health history of his paternal grandfather is unknown. Nelson is currently not taking any medications or over-the-counter medications. He has no known allergies, and he is up to date on his immunizations. After hearing the subjective history, let's take a moment to answer some questions. First one, what systems would you address in your review of system? So if you think back to the full purpose of this visit, what was it? It's a wellness visit. So with it being a wellness visit, you should do a full review of systems. So that means including all of the systems, but you should focus on the GI system as his parent, Kylie, voiced some complaints stemming from that particular system, meaning that she was discussing poor appetite and also some constipation issues. Question number 2, after reading about Nelson's subjective history, what stands out to you as an issue? So we kind of said that a little bit already. She stated that he's not eating as much lately. Some other things that should stand out to you is that he's drinking 5 8-ounce bottles of whole milk daily. That's quite a bit of milk for his age. He's not taking any multivitamins. He has occasional constipation. And then another thing to consider too that maybe didn't pop out to you right away, but you should always keep in the back of your mind that his family is on WIC and they are receiving government resources. So when you're developing your management plan, you'll have to keep that in the back of your mind. So what other questions would you have liked to have asked? If this had been a real patient, what more would you like to know? Some of the things that I would have liked to have asked is how many stools is he having a day? Does he cry when having a bowel movement? Is there any bleeding when he has bowel movements? Does he grunt during bowel movements? What foods does he like? Is he eating any veggies, any fruit, any meat? How often is he eating finger foods? Is he eating it, or is he drinking any water? If so, how much? Honestly, the list of questions could go on, but as you start having your own patients that come in with these frequent issues of peds is what you want to go into, you'll develop your own way of organizing your thought process, so you'll know exactly what questions you want to ask. So despite this being a well baby visit, what is the mother's chief complaint? Again, we kind of talked about this. So she's complaining that he's not eating as much and he's constipated. So what is your developing differential diagnosis? Now that you have his subjective data, you really should start formulating this differential diagnosis in your head. So again, we want to make sure that we rule out any urgent abnormal, rule out any urgent diagnoses. So some of those can be celiac disease, a bowel obstruction, any possible early onset diabetes, anything like that, that would be of immediate concern. Okay, some other things that it could be that you would want to rule out would be hypothyroidism, maybe a vitamin D deficiency, abnormal abdominal musculature, and then a slow transit could also go in with that as well. So those are some of the things that you would want to rule out. This is a really good point when you are practicing case studies, and I highly suggest that you practice case studies. Go on Amazon, go to Barnes & Noble or something, find a case study book. I highly suggest that when you are working through these, use your Nursing Central app. You guys have a great, let me pull it up here. You guys have a great resource at your disposal. It has the 5-minute pediatric consult guide, and you literally can go in there, type in a topic, and it'll literally give you all of the information that you need to know. There is also the, I think it's called the Diagnostosaurus, I think is what that app is called in the Nursing Central, but you can type in a chief complaint in that one as well, and it'll just come up with all of the differential diagnoses for that condition. And it always puts the most urgent ones up at the top. The ones that aren't as urgent, it'll put closer towards the bottom. But it really kind of gives you a good idea of what things you should be thinking in your mind that you need to roll out for that specific chief complaint. Okay, so utilize your resources. I cannot say that enough. Now on to his objective data. So his weight is 6.4 kilograms, length is 66 centimeters, temperature, which I hate it when they put it in Celsius, but this is how it was, 36.8 degrees Celsius, respirations 20, heart rate of 106. Stopping here, one thing that, if you have listened to my other lecture, one thing that is really important that's missing here is a head circumference. So just remember, for every visit, you need to make sure you get a good head circumference measurement. So the general section, Nelson is alert, active, and playful. He appears well hydrated and well nourished. Skin is clear of lesions, no cyanosis of his skin, lips, or nails, no diaphoresis noted. Nelson has good skin turgor on examination as well. Head normal, anterior fontanelle is open and flat, red reflex, normal in both. His pupils are equal, round, reactive to light, no discharge noted from his eyes. Ears normal, tympanic membranes normal, gray bilaterally, positive light reflex. Bony landmarks visible, normal. No fluid behind the tympanic membranes noted. Nostrils are patent and normal. No nasal discharge, no nasal flaring. Mucous membranes are moist. Has 8 teeth present with white spots present on both upper central incisors. This is normal for his age. There are no lesions present in the oral cavity. Neck is supple. He's able to move in all directions without any resistance. Lymph nodes normal in the posterior cervical region. Lungs are clear to auscultation in all lobes. Good air entry, no retractions or grunting, and no deformities of his thoracic cage. This is just objective data continued. So cardiovascular is normal, regular rhythm, no murmur, brachial femoral pulses are present. Abdomen is normal bowel sounds, soft, non-tender. GI, normal male genitalia. Nelson is circumcised and his testes are descended bilaterally, and this is normal for his age group. They should be descended by now. If not, then that would indicate a problem. Neuromusculoskeletal, good tone in all extremities, full range of motion, extremities are warm, well perfused, cap refill less than 2 seconds, spine is straight. So now we can start to pull this all together. This is when that we go back to that list of differential diagnoses that we developed, and we want to see if anything has changed now that we have our objective findings. So what can you rule out? So if you look down in the notes section, I copied and pasted that list from the previous slide. So you have that differential diagnosis for poor appetite and constipation. Some of the things that we could cross out at this point is celiac disease, bowel obstruction, abnormal abdominal musculature, colonic inertia. All of that you should be able to rule out. Celiac disease is an autoimmune inflammatory disorder. So you're going to see other signs and symptoms of that typically. Now, with him still being young, you may not necessarily see full-blown symptoms, but by this point, and it sounds like from his mother that he is having normal, for the most part, fairly regular normal bowel movements besides the constipation. So this, at this point, you would be able to rule out the celiac disease. The bowel obstruction, he would be in a lot more pain. He doesn't appear on exam to be in any pain. He's playful, he's active, he's happy. You were able to press on his abdomen. So a bowel obstruction, you would not be able to do that. So we could rule that out. He has been having bowel movements. It doesn't appear that she's had to, assist him with removing the stool from his rectum. So we can rule out the abnormal abdominal musculature. Some of the things that we still want to consider on our list, though, is hypothyroidism. And one thing in the family history that we didn't address, and this goes back to what other questions would you ask, we could ask his mother, does anybody have any history of any thyroid problems? We could also ask, does anybody have diabetes? Anybody have issue with their sugars? So these are things that we could technically still leave on the list. Vitamin D deficiency, although he is drinking a lot of milk, that is something that we would be able to easily rule out if everything else, if we weren't getting any answers from everywhere else. Slow transit, this is pretty common in this age group. So a lot of the times what happens is that it's usually related to either a nutritional deficiency. So maybe they aren't eating enough vegetables, they aren't drinking enough fluids, but basically that whole transit of stool is slowed. And I know you guys have run into patients with this too, probably in your own practice as well. So this is very common, and more than likely that's what this is. Reason being, one of the biggest things that causes constipation in kids this age is milk. So really technically he's having more than double the dose of milk per day. Really children at that age should have no more than 20 ounces of milk per day. 24 ounces at tops. He also is old enough at this point that he would be able to drink some water, and that would be something that you could suggest to his mother. So what laboratory tests should be ordered as part of a 12-month well child visit? Well, at this point, you would want to do a CBC. That is one of the screening measures at this age group, just to rule out any anemia that could occur at this point. Iron deficiency anemia is a big thing that children at this age can experience. So that would be one of the typical screening tests that you would do. You could also, if you really wanted to rule out a vitamin D deficiency or rule out hypothyroidism, if you really thought that that might be a possibility, you could also do a vitamin D level and a TSH level at that point. Does this patient's psychosocial history affect how you might treat his case? So remember what I said, we noticed that he's receiving government resources. So that's something to keep in mind. If at one point you'll have to prescribe a medication for him, we're going to want to make sure that it's cost effective for his mother, because she's not working. The child's father is in jail, so it doesn't, she's not getting much support from him. We didn't dive in too far to her relationship with her mother-in-law, so we don't know how supportive she is. Although it does appear that she's letting her and the children live with her. So we just want to make sure that it'll be a feasible management plan for her. So what is your plan of treatment, referral, and follow-up care? So one thing that we need to make sure that we discuss with her is the causes of constipation. And this goes back to his daily dose of whole milk that he's getting. So we need to make sure that he's drinking below that 20 to 24 ounces per day. So we can tell her that the 5 8-ounce bottles is too much for his age group right now. That can be causing his constipation. It also can be causing his poor appetite, because if his belly is full of whole milk, he's not going to want to eat anything else. And so even though that seems like something simple that you should be able to correlate, parents don't. So that is something that sometimes we just have to take a moment and explain to them. Another thing is once a child reaches that year to 2-year age range, they go into they go into this period of time where they just don't eat as much. So the reason being is what they think it causes this is what research is saying is that between the ages of birth to 12 months, there is just rapid growth. During the time period of a year to 2 years, that growth slows down a little bit. So because that growth rate decreases during that second year of life, it usually signifies that a child needs fewer calories, and therefore they might be more likely to eat less. And that's just something to kind of educate her on. Everybody, I'm sure if you have children, you have seen this in your own children. I know mine, I felt like, especially my son, because he was just a mammoth of a child, but he just ate and ate and ate and ate until he was about 12, maybe between 12, 14 months. I just noticed that it was decreasing a little bit, and he would just be a little bit more picky and, particular about what he wanted to eat. Now he's 3 years old, and again, he's just eating everything in sight. So they go in spurts. So that's just something to encourage her about. The other thing at this point that we talked a little bit about already is that at 12 months, he can start using water in a sippy cup. I always encourage people, and what evidence-based practice says is usually you start out with 1 ounce, 2 ounces, and then you can increase from there. But it's important to get them used to drinking water now so that we can accustom them to water so they're more likely to drink it later on. So once they're about 6 months and above, we don't have to worry so much about them drinking water and getting like a hyponatremia. So at that point, you can slowly start adding in some water in a sippy cup. You also want to maybe encourage some use of a multivitamin at this point. It doesn't sound like because he's eating too much, he may not be getting all the nutrients that he needs. There's lots of different over-the-counter liquid multivitamins. A lot of the government resources will cover these completely as well, so that's something just to let her know. Also, like we said, you want to educate her on the causes of constipation, but also how to avoid constipation. So increasing water intake, decreasing use of milk, increasing veggie use. So, if you can get your kids to eat vegetables early on, you will be happy that you did that later on when they're a little bit older, because they won't be quite as picky. Some of the things that we can consider using with him is exactly what she's doing, the prune juice. That is a great natural way to help a child have some normal bowel movements and decrease that risk of constipation. Another thing that we can consider is Miralax. You can dose that for the pediatric patient, and it actually tends to work pretty well. Both of my children struggled with constipation, and so I actually used I used Miralax in both of them for their constipation, and it worked extremely well. So they can have like 1 to 1.5 grams per kilograms in 24 hours, and they can do that every 3 to 6 days, depending on how bad their constipation is. So just keep that in mind. Some of the other things that they can do is a little bit of coconut oil or Caro syrup. If you have people that aren't wanting to do a medication necessarily, they can use some of those things. They can also use like some mineral oil. They can also use Senna, and that'll have to be dosed per kilogram. However, evidence-based practice does not suggest using that for long term because it can be associated with colonic nerve damage. So just keep that in mind. But really encouraging a balanced diet of whole grains, fruits, and veggies, that's the biggest patient education piece, because a lot of parents get stressed out because their kids are so picky and they forget those things. Further lab workup, you can talk about that with the family. If you think you need to, like we said, do the TSH or the vitamin D level, you could always do that. Again, with this visit, you want to include the anticipatory guidance. So you want to talk about home safety, make sure that everything is baby proofed, since it looks like he's getting ready to take off and start walking here. Also want to talk about car safety, sleeping. It sounds like he's sleeping pretty good though. Again, talk about the eating, talk about having a daily routine as much as possible to help him. And then you want to talk about follow-up. So typically, I think on average for this, you could do a follow-up in like 1 to 3 months, just depending. You could even follow up with this at the next well visit if it doesn't seem like the mother is too stressed out over it. Of course, you can always assure them that they could call in if they have any questions. You also want to give them advice on why they would need to go to an ER or an urgent care. So, if he hasn't had a bowel movement in greater than a week, and you notice that with stools he's bleeding, and things like that. So they need to make sure, if he's just inconsolable and crying and you can't touch his belly, those are all things that would warrant further investigation with an ER or urgent care. On to case study number 2. Okay, so this is case study number 2. So Juan Carlos, a 9-month-old male, presents to the office for a well baby visit. He is accompanied by his mother, Lupe. Lupe is Spanish speaking, so a medical interpreter is used for the visit. Lupe has no concerns and states that Juan Carlos has been healthy since his last well child visit at 6 months of age. He also has had no visits to the urgent care clinic or the emergency room. Juan Carlos's nutrition history reveals that he is still being breastfed, but that he is also being supplemented with a low iron milk-based formula. Lupe states that she gives Juan Carlos low iron formula because the formula that is not low iron makes him constipated. He eats a diet of regular food that the family eats. He eats fruits and veggies daily. Lupe introduced finely chopped meats into Juan Carlos's diet last week, and he has tolerated the addition well. Juan Carlos also enjoys Cheerios, which he is able to grasp and eat and bring to his mouth without assistance. He is not currently taking any multivitamins. Lupe states that Juan Carlos has 4 to 6 wet diapers daily and voids easily with a straight stream. He does not have any diarrhea or constipation since beginning the low iron formula. So Juan Carlos is sleeping about 10 hours at night and takes 1 2-hour nap daily. He does not have any problems falling asleep or staying asleep. At night, he has a bedtime routine that includes a bath and bedtime story read to him by an older sibling. Juan Carlos is crawling and pulling up to stand. He makes lots of vocalizations and is saying dada, although Lupe is not sure if he is just making sounds or referring to his father. Juan Carlos has a beginning pincer grasp that allows him to eat small items such as Cheerios. Juan Carlos was born to a 31-year-old mother. He has 2 older siblings. He lives at home with both parents and maternal grandfather. The father is from Ecuador. His mother works as a housekeeper, and his father is in construction. The family has a pet bird, and there are no smokers in the house. Juan Carlos's mother has asthma and seasonal allergies. His 33-year-old father is healthy with no past medical history. Juan Carlos's maternal grandmother died at age 55 from an MI. His maternal grandfather has a history of type 2 diabetes and obesity. His paternal grandparents are both deceased because of a motor vehicle accident that occurred some years ago. Juan Carlos has no medical history. He's also on no medications, herbal supplements, or over-the-counter drugs, no known allergies, and he is up to date on his immunizations. So let's think about what we've heard in the subjective history, and let's ask ourselves some questions. So what systems would you address in your review of systems? Well, again, this is a well visit or a well child visit, so we would need to address all the systems in the review of systems in order to give him that thorough well child visit that he needs. After reading about Juan Carlos's subjective history, what stands out to you as an issue? Well, one thing that should stand out to you is his use of a low iron formula. Even though he is being breastfed, that low iron formula, because at his age he is more prone to developing an iron deficiency anemia, that should be something that jumps out at you. What other questions would you have liked to ask? So some of the things that you could have asked were, what specific formula were you using? How often? How often are you breastfeeding? Does Juan Carlos drink any water? Is he using a cup yet? What type of veggies is he eating? What is his bowel schedule? Does he have daily bowel movements? Those are some of the extra things that you could ask. Onto his objective data. And again, we're missing a head circumference here. So just remember that's something that you would always need to obtain whenever you have a child come in for a well child visit. So weight is 6 kilograms, length is 64 centimeters, temperature 37 degrees Celsius, respiration is 22, and heart rate is 102. Generally, he is alert, active, and playful. He appears well hydrated and well nourished. Skin is clear of lesions, no cyanosis of his skin, lips, or nails, no diaphoresis, and he does have good skin turgor. Head is normal, anterior fontanelle is normal, red reflexes are bilateral, or present bilateral, pupils equal round reactive to light, no discharge noticed or noted, ears normal, tympanic membranes are normal, gray bilaterally, good light reflexes, bony landmarks are visible and normal, no fluid behind the tympanic membrane, nostrils are patent, both of them, no nasal discharge, no flaring, mucous membranes are moist, intact, and he does have 2 teeth present without any evidence of caries, and there's no lesions present in the oral cavity. Neck is supple, he's able to move it in all directions, no enlarged lymph nodes in the cervical region. His lungs are clear, good air entry, no retractions, no grunting, no deformities noted, heart regular rhythm, no murmur, brachial and femoral pulses are present, normal bowel sounds throughout, soft, non-tender, normal male genitalia, he's uncircumcised, both testes are distended bilaterally, and that's normal for him. Good tone in all extremities, full range of motion, extremities are warm, well perfused, cap refill is good, spine is straight. Okay, so let's ask ourselves some questions. So which laboratory or diagnostic imaging test should be ordered as part of a 9-month well child visit? So the American Academy of Pediatrics is a really good resource for you to use. They have the recommendations for preventative pediatric healthcare guidelines, and that's on their website. So at this point, there's no recommended laboratory tests or diagnostic imaging tests for the 9-month well child visit. However, based on what we've heard from Juan Carlos's history of receiving a low iron formula, the healthcare provider, or you might want to consider a hemoglobin test just to screen for iron deficiency anemia. If the hemoglobin is abnormally low, then you can obtain a full complete blood count just to confirm the diagnosis of an iron deficiency anemia. Also, if you believe through questioning that he's at risk for lead poisoning, that is also something that you could test for at this age as well. Second question, what is the most likely diagnosis and why? So the most likely diagnosis that you're going to have to look into is an iron deficiency anemia, and then possibly some constipation issues that were going on as well. And that's just based on the history provided by his mother. He should be able to tolerate an iron-based formula. That is something that children should receive at that age because of their high likelihood of developing an iron deficiency anemia. So you want to look into how much fiber is he getting in his diet? Is he getting enough veggies? Is he getting enough fruits, whole grains? Is he starting to drink some water? How much is she breastfeeding? Is he getting too much milk? Those are all things that you should take into consideration, but definitely we need to make sure that he doesn't have any iron deficiency anemia going on because of this. Next question is, what is your plan of treatment, referral, and follow-up care? And we've kind of discussed this throughout, but the plan of treatment, you want to discuss nutrition, that anticipatory guidance, and safety. So for the 9-month visit, you want to be able to discuss safety issues such as car seat safety. You want to make sure that he is rear facing in that car seat. You want to talk about water safety, so making sure the water temperature is less than 120 degrees for baths. You want to talk about never leaving him in the bathtub by himself. Another important one, I don't know if you guys remember that old show, that 911 show. I loved that show growing up, and so I will never forget this one episode where the parents had left the toilet lit up, and this little baby about this age is what Juan Carlos is, actually fell into the toilet. Well, they obviously don't have the upper body strength to push themselves out, so he actually drowned, and I can't remember if they saved him at the end of the episode or not, but it just, you just don't, sometimes you don't think about those things. So just remind them to keep the toilet lid closed, the bathroom door closed. You want to empty the mop buckets after each use if they're using a mop. You should also discuss firearm safety, any prevention of burns, any need for smoke, carbon monoxide detectors. These are all great anticipatory guidance that you can pass on to the parents. You also want to discuss introducing a sippy cup. We kind of talked about that a little bit. You want to start weaning Juan Carlos off the bottle is what you want to tell them. Reading to him each night is great. You want to discourage any television watching or any interactive activities about an hour before you're going to get ready to lay him down for bed. But you do want to encourage them to promote interactive activities throughout the day that'll help develop proper brain activity, and such as like talking, playing, singing, reading together. Those are all important things. The next thing you want to talk about is nutrition, and we've kind of talked a little bit about this throughout, but again, he needs an iron fortified formula, not a low iron formula. So to prevent iron deficiency, anemia, that's something that a lot of parents are not aware of. So just make sure that that's something that you educate his mother on while she's there. You also want to give nutritional suggestions that could be given to prevent constipation, such as maybe pureed prunes or prune juice, making sure he's getting a good amount of veggies in his diet. When thinking of follow-up for Juan Carlos, typically he'll follow up in about a year, or you can also tell his mother that he can follow up sooner. I'm sorry, not a year. He will follow up. He is at, a year old. That was what I wanted to say. So he'll need to follow up at his 12-month appointment. If any concerns arise or any issues, then you can always tell the mother to follow up sooner before that. I hope that helped going through some case studies. As always, if you guys have questions, feel free to email me, or you can also email Professor Luther. Just let us know if you guys have questions. We're here to help you. So, as you're going through the content, write down your questions. We also have the Big Blue Button conferences coming up, so pay attention to when those dates are. Bring your questions for us. We do have a Q&A session, I think at the end of this month or the beginning of next month. So go to the announcement section, look and see when those Big Blue Button conferences are. For the Q&A session, just make sure that you have your questions emailed to me in 48 hours in advance. That way we can just kind of be prepared a little bit to answer your questions. We want to make sure that we're giving you evidence-based practice and also giving you some references to resources that you can go and look and get some more information on that question topic. Okay, thanks guys.